there in Facebook land. Hello, friends in Facebook land. How are you? We are here with Dr. Ferrara, and we have a very exciting show for you guys today. So, Dr. Ferrara, do you want to say hi to everybody?
Hello, everyone, and I hope you guys all had a good week and staying healthy. I know the flu is going around, and I hope last week where we talked about the tips for the flu, we've gotten a lot of feedback, and a lot of people shared all the tips and ideas.
Right, absolutely. We've got a lot of tips for you today as well. You gave a lot of tips last time, and people really enjoyed your tips. So thank you so much for being here and doing this here with us. But we definitely appreciate this. So this week we have a different topic.
Yes, we do.
And this topic is, what is this topic?
Well, the topic is about wound care. I keep in my practice for years, it's about just wound care as far as whether people know how to take care of wounds before they come in or when they're at home. And there's so many different ways to take care of a wound. And we got the idea just from different patients. I actually had somebody, to give you an idea, all the different ideas are out there, they've been in movies. We recently had somebody who treated a wound with garlic.
Wow, with garlic.
Garlic. And whatever reason, garlic caused a second-degree burn on top of that wound.
Wow.
Made things worse.
That's amazing.
So that's what I'm saying. There's a lot of tales out there about how to take care of a wound and what's the best way to do it. And so if anybody's out there would like to share what they think is their way of treating a wound, what they feel as far as a wound, like a abrasion or a cut, how to keep it from getting an infection, basically what we're talking about, and what to put on it afterwards. We'd love to hear everybody else's ideas out there.
Absolutely. If you guys are watching this right now, please feel free to put your comments up there, and we'll definitely go ahead and go from there as far as what do you think is the best way to treat a wound, because a lot of people said, you definitely don't want to put salt on a wound.
Yes. Or some people, as they mentioned, vodka or something like that.
Exactly.
But you could, actually. It's a good sterilizer.
Wow.
They used to sterilize wounds, during the Civil War and stuff. They actually would put alcohol on it to sterilize wounds.
Wow, I didn't know that. So if you guys are watching this right now, we are talking about what are some of the best ways to actually basically deal with a wound. And this is what we're discussing here today. And Dr. Ferrara, can you give us a couple examples of what you think is some of the best ways that you've seen in your practice?
As far as taking care of a wound?
Absolutely.
I think there's only one way. I don't know if there's multiple ways, in my opinion. It's high pressure, potable water. Means drinkable water. Means water out of a faucet, high pressure. Out of a shower, high pressure. Out of a syringe, high pressure. Just, if you could imagine a river just washing down the wound and the sediments and all that.
So when you say high pressure, give me an example. You mean like the shower running down?
Not shower, as a high pressure shower, or as a sink, high pressure. I can tell you a story, and it always sticks out in my mind. I was working at one of the local trauma places here, and there was a patient that he had cut his hand. I had to beat the hand because I brought him to the sink. He was one who was busy, and I said, okay, we're going to wash the wound. And I turned on the faucet, high pressure, used soap. And that's the other thing, is high pressure and plain soap.
Okay.
And took care of the wound, stitched it, whatever. The next day, I just didn't explain to the gentleman. The patient did not ask why you're doing that. So next day I get a call from my the ER director. Said, hey, this guy complained. I said, you didn't clean the wound. You used potable water and stuff like that. I said, well, let me tell you, and if it was good enough for the Army at the time, I'd just come out of the Army.
Okay.
And what thing we used potable water, high pressure, or saline, and soap. And we had a very low infection rate. And he goes, that's what you should have told him. He goes, because in reality, the studies all show that no matter what wound, the thing that takes care of the best is running water, potable water, or saline, but plain tap water is fine.
Wow.
And soap. Wounds come out the best, least rate of infection. And then everything else is just secondary. And the other thing I want people to get out of this is that they always talk about hydrogen peroxide. Well, hydrogen peroxide doesn't necessarily take care of the bacteria really well.
Okay.
The second thing it does in an open wound, when a wound is opened up, when we close it, all we're doing is bringing the edges together, so that when the edges are together, it sends really a signal to the body, say, okay, start healing.
Okay.
And start healing with all the proper proteins and everything, so you have the least amount of scarring. And hydrogen peroxide or alcohol in those wounds, even though it sterilizes all that, actually kills that healing process.
Wow.
So they're still going to heal, just going to have a bigger scar.
Right.
And in reality, the infection rate, when you compare normal saline soap and water versus hydrogen peroxide, there's a big difference.
What about when it comes to the like using like Band-Aids and things like that? I mean, is that okay as far as?
Yeah.
Okay. Some people said, I remember just hearing people say you should leave your wound open.
No, that's
okay.
totally the opposite.
Okay.
Because just the basic anatomy. Think about the skin is one of the most protective barriers. The reason for our skin is what's keeping the environment, everything outside. We're getting hit by germs all the time. I mean, all the time. No matter how clean we get in shower, we always gonna have germs on ourselves, and the skin is the biggest barrier against germs. And anytime you break the skin, either when you shave your face or you scrape, you break that barrier. And so an exposed wound, but not covering up, you're leaving that break open. So I think keeping a wound covered and cleaned is the way to go.
Wow, that's awesome. So if you guys are watching us right now, just please feel free to put your questions out there, because this is why Dr. Ferrara is here to talk to you today. So if you have a question about cleaning a wound, or if you have a question about maybe something in particular when it comes to this, please ask your questions, because this is why he's here right now to answer any questions that you might have when it comes to this.
Do you remember when, you're probably not old enough to remember, they used to have this, I don't even know what they called it, stuff in wounds. It used to be red. They used to put like a little, like a Q-tip, and
yes, I remember that. Yes, I remember that. Yes, I remember that.
I mean, that didn't do anything.
Okay.
And the next thing they started doing was betadine, which they use still in wounds. I don't, it's not. It's great to clean the skin, sterilize some stuff, but ultimately, is not as good as running water and soap. They even tried mixing with saline and water, betadine like mixture, and injecting it, and still doesn't do as good of a job.
Wow.
As just high pressure water. So if you have a wound, you have a kid out there, just put in the faucet, if it's the hand or the knee, and the shower, and just wash the soap and water. I think a Band-Aid is good. And they say antibiotic ointment. And my choice is always to go with what's called bacitracin.
Okay.
Everybody talks about Neosporin. Everybody talks, we got to put Neosporin on it. Unfortunately, Neosporin is it's basically a triple antibiotic, and one of them did. 1/3 of people get an allergic reaction.
Wow.
So they end up coming in and say, oh my God, my wound got worse. It's itching and stuff. It's almost like getting poison ivy. So I just avoid that issue and just use bacitracin. So.
Okay, I think Leslie said that was actually called
mercurochrome.
Right, absolutely.
Mercurochrome.
And that so basically,
I'd love to find out what was in it. It was mercury or whatever that was in it.
And so you said it did nothing, basically.
Basically did nothing, no.
Wow. And that was like a hot and popular thing back in the day. So
yeah. I'm old enough to remember it.
I do too. I remember that too.
You remember that? I wonder if it's still sold. I'd be curious. I bet you it is sold somewhere.
Now, what about how soon should you treat that wound? I mean, is that immediately, or how does that work?
Yeah, as fast as possible. Most wounds, no matter what you do, even if you cut yourself in the shower, it's always going to be dirty. So you don't wash as soon as possible. And even if it's hours later, it doesn't mean you had an infection, things like that. The sooner you can do it, the better it is. But if you go, like, say, 2 hours, you're in the middle of the woods, so you get somewhere. I mean, don't panic.
Right.
You definitely do not want to wash it with running river water,
or
stream water, or lake water. That is not potable, clean water.
Okay.
You want to, potable water is water you boiled, or water that it comes out of a sink. That means water that you can drink safely.
Absolutely. So if you guys are out there and you have questions about this, please put your questions up there. And we're here with Dr. Ferrara right now to answer some of your questions out there, especially when it comes to these issues. Because like I said, now, what about like people, let's say you have a knee injury or something like that. I'm sure you should wash your hands thoroughly before you actually start to work on that.
What do you mean?
I mean, just like wash your hands so that you won't get any other like germs or anything like that.
Of course, yeah. Before you clean a wound, wash your hands or use gloves, and then just use soap. And again, the best time, even if you have stitches, let's say you have to keep your wound clean, I tell my patients, okay, stand underneath the shower, wherever that wound is, if it's your foot, put soap on it and let the water run for about 2 or 3 minutes every day. And we rarely get infections by doing that. And that's very important because a lot of people don't understand that there's a lot of confusion about how to clean a wound. Believe it or not, just old-fashioned plain soap and just running water is still the best way to clean a wound.
Wow. And typically, how long does a wound stay open, basically?
Usually a wound closes within 24 or 48 hours.
Okay.
It doesn't fully heal as far as close up, let's say 10, 14 days, but the actual full wound healing is about a year, actually.
Wow.
That's why I always tell people, don't worry about the scar looks like. Give it about a year before you worry about it.
Mm-hmm. Absolutely. So if you guys are out there and you have questions about this, please feel free to put your questions up there. And we're here to answer any questions you may have on this particular topic today. And like I said, a lot of people do have questions about this, and you said this is a very popular thing right now when it comes to wounds and things like that. And so this is why we're talking about this today, guys, to give you information about this particular topic in general.
Yeah, we're talking about wounds that most of the wounds, if you believe it, a lot of people right now get home to cook. They cut themselves on a
That's
kitchen,
pretty common, isn't it?
Very common.
Okay.
Kitchen knife. I think there is at our clinic, probably almost every night, we have somebody cutting themselves while cooking almost every night. And thank God they're selling less. You used to have this item, I think they still sell, called the mandolin.
Okay.
I think of a mandolin as something you play, but it turns out always people coming in is a cooking item to slice. And so many cuts from this thing called mandolin. I think less and less people are what do you call it, not buying as much.
Absolutely. So we are here with you guys this evening, and we're here to answer any questions you may have on this particular topic here today. And so feel free to put your questions up there. And again, we're talking about, what is the best way to basically deal with the wound. And Dr. Farrar is here giving us some tips about things that he's seen and how to actually deal with this particular situation. Now, a wound is different from an actual major cut, correct?
No, to me, a wound is a wound.
Okay.
But even, we use the same system, so with the Army, we had, combat wounds.
Mm-hmm.
It was the same procedure. But even in operating room, when they wash out inside, that's how they do it. Saline with high pressure, irrigation, and suction on all wounds. That is the way to clean it.
Wow. So it's basically, like you said, basically soap and water is still the best way.
It's the best way to do it.
But why are we told all these other ways are the better way?
I'm not sure why, because there's a lot of old wives' tale.
Right.
We talked about fever is bad, and turns out we learned it's really not that bad. Or cough is bad. No, cough is really good for you. So no, and the wounds and clean, soap and water is the best way. But obviously, if you're in a sterile environment, like an operating room, saline is the way to go.
Mm-hmm.
The water we drink, at least in the United States and in Western nations, it is the stuff that comes out of faucet you can drink is still very clean.
Wow. This is what we're discussing here today, guys. So again, we are talking about cleaning the wound and what actually occurs and what are the best ways to actually do it today. And this is what we are discussing here today. And so you have any other tips that you want to give, Dr. Farrar, about that as well?
No, I think those are it. Soap and water. Avoid hydrogen peroxide or anything else. Use bacitracin.
But doesn't soap hurt?
No.
Okay.
Even perfume soaps. No, soap should not hurt.
Okay.
I tell you what hurts would be putting stuff like alcohol. Sometimes people want to wipe with alcohol on a wound.
Okay.
That burns. Again, alcohol putting on a wound and I mean alcohol like alcohol pads or even vodka does sterilize the area. However, just like hydrogen peroxide, it kills the healing tissues that come together. Maybe on a scrape, you don't have to put together. You always have an abrasion, like you fall down, or these players. I think I don't know where the Super Bowl is. They're playing on turf. All these players, every time you fall, you always get this big scrape. They call it rug burn.
Right.
And on playing football, if you don't clean it, you'd be surprised how many wound infections we have seen. Not a lot, but we do a good job of cleaning it. But sometimes the players don't really clean it real well. Use other things. Next thing you know, the leg is infected.
Wow.
So one of the things we do early on in the Georgia State trainers, they do a very good job of doing good wound care and teaching the players, and we are teaching the players good wound care. so that we don't have infections and spread to other players.
Absolutely. So, all right, guys, we are here, and again, we are discussing this. And so, you have any other tips or anything like that, or?
Nope. I'd love to hear from anybody out there if anybody has any comments. But that is the basic lesson for today. Is just plain soap, running water, basic tracing, and cover it up. And then if you need stitches, come on in. Let us take a look at it. Right now, stitches doesn't necessarily mean pain.
Okay.
Doesn't mean needles.
Okay.
All the time. Some wounds can be taken care of with what they call glue.
Okay.
And believe it or not, it's
now what is that glue?
Glue, believe it or not, is the same components, a diluted version of it. Remember, you used to have this glue called Crazy Glue?
Absolutely.
Yeah, it's a diluted version of that's sterilized. And believe it or not, it's been around since the 50s. It's always been used in Europe and Israel, which I know you're fond of Israel. And to close the inside of wounds, it's always been used there. And it came around to the United States about 20 years ago.
Okay.
And now it's more and more use. It's interesting. Took that long for the FDA to approve it. The other thing is sometimes just for speediness sake, we numb up a wound using lidocaine, same stuff they use when you get when you go to the dentist.
Right, exactly.
And so now
I've been there plenty of times.
What we use is a mixture that we make that we put on, especially kids. They're afraid of needles and things, and we put this stuff we call lead. And what it does is it just numbs it up after 30 minutes, and then we just either stitch it up or glue it. And the kids are perfectly happy. And we can do that in adults, but most adults can take the bee sting, what I call them, just going to feel a little bee sting.
Absolutely.
And stuff. So wound care is pretty advanced right now.
So, all right, well, we appreciate you guys tuning in today. We're not going to be in here that long. We just wanted to come on and give you guys some basic information about some of the things that we are discussing
Feel
here
free
today.
to share this with your friends, because I think this is the kind of information that when you go online, they'll give you a million different things.
Absolutely, and that's
and I'm wondering, like Tamiflu, everybody's all these wonderful things about Tamiflu, and I'm wondering if it's somebody like the drug company with its bots putting all this information. I wonder, and a lot of information. But anyway, hope you have a great week. I think we're gonna have a great topic for you guys next week. I think we're thinking about how to sleep better.
Yeah, that's going to be a very interesting topic. So that'll be a lot of people. I always see post things on Facebook about they can't sleep. So that'll be a very interesting one next week.
And we'll have a special guest to help with that.
Absolutely. So thank you guys so much for tuning in. And we will be back with you guys next week. So have a fantastic day. Thank you guys so much for watching. Appreciate it. Bye-bye.
Peace. Sure.